Hey guys, so I totally decided that I'm feeling better and I really wanted to do a vlog and talk about everything that's been going on, like my port-a-cath surgery and recovery. I had actually spoken to the doctor and I had asked him about my different options for ports, and I had said, I'm really sort of considering an arm port. And he just flat out told me, he's like, no. He said they're very faulty, there's always problems with them, and they're just very unreliable. It's just better to get a chest port. And I will have to say, the one thing that I like about a chest port is that it doesn't really interfere with anything. I talked to him, and he said that he really thinks that he really thought that he could get the port in the same space. He said, really, we just have to open you up and sort of see what the situation is. So I was awake during surgery. Before they did anything, they put the IV in, and it really wasn't bad at all. She used like a baby needle, like I think a pediatric needle, whatever, and it wasn't too painful, and it was just enough because all they need to do is give you Versed and fentanyl during the procedure. And it was the strangest experience because I have done consciously sedated procedures before. The one that I've done frequently is the bronchoscopy, which Dr. Belkin does consciously sedated. And to me, it's the exact same as surgery because they give you the drugs and, like, that's it. You're out. Like, you don't know anything until you wake up. But apparently, you're awake the whole time. But this was just strange. It was like they gave me the drugs and I felt it. I felt very relaxed. And so, anyways, but it was so strange because they pour all this, like, blue stuff on me, and I remember, like, I was laying on the bed and it was dripping down my back, but what they did was they opened this big blue sheet, like a sterile blue sheet, and they draped it over this whole area and put it over my face. And then they had like an open hole, like right here where they were doing all the work. And so I didn't see like anything. All I could see, and I had to have my head turned this way. So they're working like right here, and my head was turned this way, and they had to put that like beret thing on me, that blue like surgeon's cap. So I remember just like looking this way, and like I could see like there was a nurse standing there at all times, and like, she kept like looking at me, and she was sort of like my reference point. And so that was fine, and it was just weird because I really felt like it was just 20 minutes, and there was like a weird point in which I kind of like was like a dream. It's like the point where you're like in between sleep and awake, sort of that weird moment. And it was sort of a moment like that. And like my brother was with me, and like we were going to go get ice cream. And like it was just like, I just sort of had this realization like, wait a second, I'm getting a port-a-cath. Like it was very, very strange. And I knew that I wasn't conscious during the whole time because my pulmonologist came in to my room after the procedure was done, and I said, oh, like, I thought you were going to come see me before surgery. And he's like, Christina, I was in the room. Like, do you not remember when I came in there? And I'm like, no, I don't remember that. So apparently he came in there, and it was strange because I looked at the clock when we got back to my hospital room, and it was 10:30. And I remember like thinking, I just went down there at like 8 o'clock. Like, that was like, what happened to the time? That was really bizarre. So anyways, that's sort of my story. And the only thing that really hurt was the only thing I could actually feel during the procedure that hurt was when they put the catheter into the vein. And I remember laying there, and I could like feel him like shove it in there, and I was like, oh God, like, ow. And it wasn't like unbearable pain, but it was definitely like pain. And this whole thing has been really sensitive. And when I came out of surgery, I wasn't like in unbearable pain, but like I couldn't use my neck. So the first day was definitely, it was interesting. When I came out of surgery, it was just this. And then after, because they had completely numbed this area, like locally, with local anesthetic. And as soon as it wore off, like, a couple hours after surgery, like I was in some pain. Like I could really, really feel this. And they had accessed it after surgery because my doctor wanted to give me some antibiotics via IV after the surgery, just to like prevent infection and staph is the most common kind of infection. And because I have a history of MRSA, he really wanted to put me on some vancomycin, so he gave me 2 doses of vancomycin within, I think that it's every 12 hours. Pretty sure it's every 12 hours. The next day was much better. My biggest issue with this whole situation was like when I cough, this area starts throbbing. And so I wasn't really coughing the first day, and respiratory comes in and they wanted to do some chest percussion. And I look at them like, you have got to be kidding me. They brought in a vest. Like, there's no way I'm putting a vest on right now. Like, yeah, no, no, not putting a vest on. So they said they could do manual chest percussion. I just said, I just think it will be too painful. Well, today I could really feel my lungs were starting to get junky because even though I wasn't, I just wasn't coughing as much. And my pulmonologist came in and he's like, Christina, like, you need to be taking, like, you need to be on the maximum dose of pain medications, like, to force yourself to cough, and I'm the kind of person where I would rather just like have the pain and not take the pain medications. I hate taking pain medications. Like, I just don't like putting extra drugs into my system, and plus pain meds are kind of serious. Like, they wipe you out, you get nauseous, like it's a little intense to take pain meds. So and he even had a prescription for morphine for me. I did not use that. But I came in today, the respiratory came in today, and I was like, okay, you really need to do some chest percussion. So I didn't lay down or anything. I just sat up straight, like how I'm sitting now, and I just had the guy do manual hand percussion on my back. And what's really good is, the RTs at the hospital are like pros at it, so it's not like you have an amateur at home like slamming on your back and it really hurts and they're doing it wrong. Like, he did it really good, and um, it didn't hurt to do the percussion because he just did it on my back. It just hurt to cough, and I could tell like it was like sitting deep inside of me, and I'm like, gosh, I'm not looking forward to coming home tonight and doing my hypertonic saline and coughing my brains out because I feel like my port-a-cath is gonna like explode. So anyways, before I left the hospital, they had to de-access my port. And let me just say, I hate, like, to me, de-accessing the port is worse than accessing the port. And when I was 8 years old, I learned how to take my own needle out. And ever since then, I have never once, well, okay, I've never let somebody do it. The only exception was when I was in the emergency room last time, and that was a mistake because the guy didn't hold the port-a-cath down. He just ripped the needle out, and oh my God, I thought I was gonna die. Like, it hurt really bad. So my nurse, she's like been my nurse several times before, and we had to slowly take the tape off. You can see like this is the bandage, and it's not a typical tegaderm. It's like a special kind of tape. So they actually had to take this bandage off, and so she had to like carefully peel off this tape so that she didn't peel off the steri strips, and it was so tender. Like, it's tender just to touch. And so anyways, she told me, she's like, do you want to de-access it? And I'm kind of sitting here like, oh my God, like, that's going to require me like touching my port-a-cath, and this is really painful. So whenever I de-access my port, I have to stand in front of a mirror. So of course, like, the mirror's like up to here, so I'm like having difficulty seeing it. Of course, it's one of those like stupid safety needles that I don't even know how to use. So I literally sat there. It took me like 2 minutes to pull out the needle because I think it was like an 18 gauge needle, which is a really thick needle. So I was sitting there like barely like putting pressure on this and pulling out the needle as slow as possible, and it came out. So anyway, she had to like patch the dressing up again, and this Friday I'm gonna be going in for a post-op. So we'll just make sure everything's good, and if you guys can just pray that this thing doesn't get infected, that would be really great because I'm like a higher risk for infection because like it's not a clean area and because I had previous port in there, and but the guy was great. So if you ever need a port-a-cath, I can recommend a really great radiologist. So this video is actually turning out to be really long, so thanks guys for watching, and I hope you guys have a great day.